So once a family has a diagnosis of autism, we think about what sorts of services will your child benefit from? What kinds of services are you going to ask for? So what kinds of services and what kinds of therapies does a child with autism generally need? The first is not every child needs all of the same services. One of the terms that we use, one of the phrases that we use with autism is that we say, if you've met one child with autism, you've met one child with autism. And so each child's treatment plan may be a little bit different, but there are some commonalities of therapies that most children benefit from. For example, most children benefit from speech therapy. Now, this could be therapy for a child who doesn't speak and is just learning to speak. In that type of therapy, the therapist will work on actual speaking, but they also may use other types of interventions that helps a child learn the benefit of communicating. For example, they might use a picture exchange system so that a child can pass a card to a parent or to get what they would like. They may use some kind of augmented communication device or computer that helps the child learn to communicate and appreciate how useful it is to communicate with others. Sometimes families are concerned that using other modalities may make it more difficult for their child to speak, and we have not found that to be the case. In general, we like to have a child use every mode of communication, from gestures to pictures to almost anything, including speaking. We want them to engage and in any way that they can socially. For some children with autism, speech therapy is focused more on pragmatic language or the use of language socially. And in that type of speech therapy, they will learn how to have a conversation, learn how to ask appropriate questions to other people about their interests, learn how to chat, learn how to keep a conversation going. So there are a lot of different things that can actually happen during speech therapy, and it's really based on a child's individual skills. Children with autism also frequently receive occupational therapy. They may receive that type of therapy because of impaired fine motor skills, lack of coordination, difficulty with dressing themselves, buttoning, snapping, self-care. They may also receive an evaluation in occupational therapy that is focused on sensory issues. All of us, everyone has sensory preferences, and frequently children who have autism have very strong sensory preferences. And so an occupational therapist will do an evaluation that looks at a child's preferences and then helps the family and parent appreciate what is calming or irritating to a child. For example, some children are very bothered by loud noises. Some children like loud noises. Some children like very tight clothing. Other children like very soft, loose clothing. Some children like to be held very tightly. Some children don't like to be held at all. So the occupational therapist can really help define what the child's preferences are and help with that. In addition, an occupational therapist will likely look at eating patterns. What kinds of preferences does a child have? Do they have a certain preference in the way their food looks, in the textures of the foods, in the temperature of the food, and work through that with the family to help both help the child get what they need as far as food, but also maybe start working on expanding that child's interest in different foods and eating a more varied diet. Frequently, children with autism have very restricted diets, and we will engage them in different therapies to help them expand their interest in food and their dietary repertoire. For example, sometimes to do this, we will make sure that children are engaged in all aspects of food preparation, from going grocery shopping to working in a garden to cutting and chopping food to actually cooking it, even if they don't eat it. When you participate in food preparation, you are much more likely to engage in actually eating the food. Another therapist that is frequently engaged in the care of children with autism is a physical therapist. If a child has a lot of motor incoordination, this can be very helpful. Sometimes the physical therapist will do direct therapy to work on balance and coordination, and sometimes they'll guide the family in finding an appropriate sport or activity that is age appropriate, and the child can work on their coordination in a more age appropriate way. Some children with autism have difficulty participating in sports where they have to pay attention to a lot of input from different children, and so they might do better in sports that are individual sports, such as swimming, gymnastics, dancing, martial arts, almost any sport that you can think of that has an instructor, and children all respond to that instructor and follow the instructor's directions. A mainstay of therapy for autism, for children with autism, is behavioral interventions. And in general, these behavioral interventions are performed by a board-certified behavioral analyst. What the behavioral therapist will do is look at a child's behavior and look for what is the motivation behind the child's behavior and try to redirect it into a more appropriate behavior pattern. For example, a child, every time they want attention, and most children want attention, they might scream, or they might cry, or they might throw something. So what a behavioral analyst will do is look at that child is looking for attention, and they get it. We're actually reinforcing them screaming by giving them attention. So what the behavioral therapist will do is try to switch the situation so that the child seeks attention in a more appropriate way.